how on time the Army is. The entire Army.
Punctuality. Man.
No day.
That's right. We got everybody? Okay. Do we have do we have folks on the phone again?
Yes, sir. We have 14 people on the phone.
Okay. So I'll just let you know who's here. Ryan McCarthy, Secretary of the Army. General James McConville, Chief of Staff of the Army. Lieutenant General Scotty Dingle, the Surgeon General. Lieutenant General Charlie Flynn, Director of Operations and Plans, HQDA. Lieutenant General Dan Hokanson, the Director of Army National Guard Bureau. And Sergeant Major of the Army, Tony Grinston. So what we'll do is the Chief will make some opening remarks, and then we'll open up to your questions. I think we have a hard stop at 1400, right? Okay. Chief, over to you.
Well, thank you, Mr. Secretary. So as of this morning, the Army has 288 confirmed cases of COVID-19. 100 are soldiers, 64 are Department of the Army civilians, 65 are dependents, 9 are cadets, and 50 are Army contractors. This week, the Secretary of Defense signed orders for 3 Army hospitals to deploy to New York and Washington State. The 531st Hospital from Fort Campbell, Kentucky, and the 9th Hospital from Fort Hood, Texas, will deploy to New York City. An advance party is on the ground as I speak. The main body will arrive at Joint Base McGuire, Dix, Lakehurst tomorrow. They will set up at the Javits Center this weekend, and they will be operational for non-COVID patients beginning Monday. The 627th Hospital from Fort Carson, Colorado, will deploy to Seattle. An advance party arrived yesterday evening. They are coordinating with state and local authorities and conducting a site survey of the CenturyLink field in a state fairground, and a location decision is pending. Our Army Corps of Engineers is engaged in all 50 states, Puerto Rico, and the Virgin Islands, assisting FEMA and state authorities. They are on the ground conducting site assessments for alternate care facilities. Lieutenant General Semonite will provide a detailed press briefing on the Corps Engineers' efforts tomorrow. Over 10,000 National Guard soldiers are supporting COVID-19 response efforts in communities in every state across the nation. Their missions include delivering food to communities, supporting local emergency management agencies, providing personnel protective equipment to first responders and hospital personnel, providing support to testing facilities, providing transportation for healthcare workers, cleaning and disinfecting public spaces, and staffing call centers to inform the public. Yesterday, the Army G1, Lieutenant General Tom Siemens, reached out to retired officers, non-commissioned officers, and soldiers who have the skills and expertise to assist with our COVID-19 response efforts. This is a voluntary opportunity for our medical soldiers for life to return to the fight if they so choose, especially if they are not currently assisting their local communities. So far, the initial responses have been very, very positive. Also yesterday, the Army directed all installations to assume Health Protection Condition Level Charlie. HEPCOM Charlie includes all previous guidance on personal hygiene, social distancing, disinfecting common areas, and having 14 days of supplies on hand. It also gives commanders more authority to restrict access to our installations and limit that access to mission-essential personnel. Our immediate response forces have assumed HEPCOM Delta to remain ready to respond to threats, just like we saw with the 82nd Airborne Division in January. We are meeting the Secretary of Defense's intent by protecting the force and supporting the national response effort. We are standing up to prevent, to detect, and treat COVID-19. This is a tough fight, but together we'll do our part to help the nation win. Mr. Secretary.
Your question.
Okay, so we're going to go to a couple on the line because we've got quite a few, and then we'll go in the room. Okay, so let's go to Hope from military.com. Hope.
Hi, General. Thank you so much for taking my question. I wanted to ask about this voluntary call-out. Specifically, you're looking for a specific number of retirees to come back, and what is the number of responses you've gotten so far, and what is the process if somebody is approved to return for the specific mission?
Well, first of all, we've got the G1 is working that. We can get you the exact numbers, but we have had some positive responses. What we're looking for is medical expertise. And Surgeon General, you have anything you want to add on that?
And then in addition, what we'll do is, even though we get in many volunteers, we then will walk through the process of certification, making sure that all certifications and credentials are straight. Then once we do that, we will plug them into all of our medical treatment facilities as required in support of the mission.
Okay, we got Lita Baldor on the line. Lita?
Yes, I'm here. So I had just a couple of questions, if I could. On the volunteer effort, can you give us even a ballpark number of responders so far? And can you talk about how much staffing the field hospitals may strain the actual active duty, and how many more hospitals can you actually, or do you actually think you're going to be able to get sent out to the country at this point? And then I have a follow-up.
Why don't you take that one, Scott?
So the general number of a hospital center, which is the headquarters, as well as the field hospital itself and all these supporting detachments, is roughly around 330 soldiers. Those soldiers that are assigned to medical treatment facilities, what we call military medically assigned personnel, their primary mission is to support the force. When they are called upon to deploy, in this case here, to support the whole of government or our nation, those medical providers, we look at cross-leveling within the medical command. And then the volunteers that you're talking about is where we also will leverage, in addition to the Army Reserve, to fill those holes from the medical treatment facilities so that we can maintain the readiness of our soldiers as well as to the beneficiary population.
And we'll follow up with the exact numbers. Our G1 is that going, but there's been positive response. We'll get you the exact numbers.
You have a follow-up, Lita?
Okay, and then, yeah, and can you just talk a little bit about what type of impact the stop movement has had on training and where you stand on training right now? Thank you.
Yeah, I'll go ahead and just talk a little about the training on the stop movement and really on the mission essential. You know, we're continuing to train mission essential personnel, but really what we're trying to do is we're trying to balance protecting the force so we can protect the nation. And each commander is taking a look at the critical missions that they have to determine just how much training they have. But regardless of where we're training, we're putting in effect what I would call almost a safety bubble type mentality. So we're training squads, and really we're looking at squads in below type level. We are keeping social distancing. And when we maneuver a squad, we usually have 5 meters in between members. Just in case, you know, in a tactical situation because of the threat. In this case, there's an invisible threat, but we still need to keep that distance, and there's soldiers that need to perform critical functions around the world, and they will continue to do that based on the commander's assessment of the threat to the force and the threat to the mission.
Okay, we'll do one more call on the line. Sylvie, and then we'll go on the room. Sylvie?
Hello, this is Sylvie from AFP. I understand that you had a hearing, a SASC hearing this morning, and I wanted to know how you did that, and was it a video conference, and how did it go? Can you give us an idea?
So what you're referring to, our Senate Armed Services Committee posture hearing, we submitted our statements for the record, and then the Committee of Jurisdiction, in this case the Senate Armed Services Committee, will then come back with a series of questions, so this transaction will be conducted in the digital space.
Ah, okay. So it was not really a hearing?
No, not in the traditional sense.
Yeah, more a paper hearing.
Yeah.
Okay, so we're gonna go to in the room. Tom?
General, you said 100 soldiers tested positive for the virus. Can you say where they are? Are there clusters at particular bases? How many are in the States? How many overseas?
Well, I'm not going to get into the exact numbers of where they're at, but they're pretty much spread out. We have not seen clusters yet.
How many overseas, how many in the States?
I need to get, I don't have that broken down.
And also, the effort in New York, how many beds will you provide with that field hospital personnel as well?
Yeah, as far as the beds that are going to New York, and they're coming with 284, 240. But I think what we're going to see happen is, and this is a good interagency kind of coordination. They're going into a fixed building, which means we won't be setting up tents. FEMA has the capability to put in place, which they have, hospitals, beds, and equipment, and they're doing that right now as they speak. We're still bringing our equipment there because we want to make sure that we have it. But what you're going to see is a good whole government effort where, the state is contributing, FEMA is contributing a lot of the equipment and structure inside the site, and then we will be providing personnel to actually staff that hospital and do non-COVID-19 type care, and that may give us actually more beds as we go through.
And the staff, how many staff roughly?
Go ahead. What's that? What do you want to give that 3?
330?
I want you.
Yes, correct. 330.
And the beds you said are 248 roughly?
284. 284 in that one, and the other one has 248. That's what because we're I don't want to get into as far as the transition between hospitals, but basically that hospital went with 284 beds, and the one that's going out to Seattle will have 248 beds. But again, there'll be beds set up there, and how we actually staff the beds, we'll probably see a lot more than that.
Because what's important for the context of your all's reporting, they can bring that capability and stand it up, but to the chief's point, falling in on existing infrastructure increases your ratio of people that you can take care of.
Also speed. It's speed. I mean, that's when you look at it. We got an order Tuesday. They're on the road Wednesday. They're doing the coordination. And this weekend they're going to be putting people in there. And then Monday we expect to be taking care of patients.
Okay, we'll go to Jennifer.
Yes. Did you have a meeting on Monday or earlier this week in which the conclusion was that the Army was not mitigating fast enough for the rise of COVID cases and that you were short of money? There's a report that James Laporta put out that has what looks like an official document from that meeting. I just wanted to confirm with you that that in fact took place and that that was an accurate report.
I'm not familiar with the reporting. I'd probably need more context. We're constantly making assessments of the resources that we need to sustain this effort. I think you'll see in the supplemental bill, we have a request to increase our efforts of prevention, detection, and treatment to sustain this over the long term, but I'm not familiar with that reporting.
And General Abrams was probably the first to have to deal with COVID out in South Korea. When did he put up the call to Army headquarters, if you will, and when were you aware of what was going to be needed for various bases, and did you take decisions to lock down other formations to protect the Army?
I'll say a couple things, and maybe we get General Flynn up here. The Army stood up a crisis action team on January 26th, right, Charlie? Yes. And both the chief and I traveled to South Korea in February, and that's when we started to learn more about this. But I think it's really important to appreciate, over time, it's taken a lot to learn about this issue because so little information came out of China on the front end of this process. General Abrams is truly the pacing item for the department. His tactics, techniques, and procedures that he and his command have developed have made a tremendous difference for the department. Along with some incredibly strong leadership from that team. So I think, Charlie, if you want to fill in some of the blanks there, but that's the rough timeline.
So, Jennifer, I would say to the date the Secretary mentioned there, I think what's important was breaking out in Asia, in China, and General Abrams, we were watching what was going on. So when those indications happened, because we have, a lot of Army soldiers and families in South Korea, and our 8th Army headquarters is over there. That came to us in the G3, and at the time, like we traditionally do, we stand up what's called the crisis action team just to track and monitor what's happening. And we've been doing that since late January because of what we were seeing in Korea, and that helped us understand now better because, as the Secretary and the Chief have mentioned, we've been watching this for a while.
I was just going to add, the other thing we really started doing is looking at our exercises around the world. We looked at the type of training that we were doing in Asia. We also took a look at Defender 20 and said, okay, which exercises do we want to reduce the scope of to give us the capability to limit exposure? And we did that.
Because, traveling in that part of the world in February was incredibly interesting. When, I was the week before the chief, Philippines, Thailand, and how little they knew. And they were on the front end of this storm. And then we started putting some of these data points together and trying to string it together over the course of February. It's been a very, very complex issue that it's taken time to get the data points together.
Okay, so we're going to go on the line again. We have Haley Brisky, Task and Purpose. Haley?
Yes, thank you. I actually don't have a question. It was answered earlier, but thank you.
Great. David from CBS?
Yeah, two questions. One is just a numbers question. You've been talking about beds and personnel for these field hospitals. You say that initially, at least, it's just going to be the personnel falling in on the facilities that are being built at the Javits Center and at the final location that's chosen in Seattle. So, in total, how many personnel, medical personnel, is the Army sending to New York City, and how many medical personnel is the Army sending to Seattle? And then I've got a second question.
Okay, so the hospital personnel going to New York is roughly 650 people, and a similar number, maybe a little bit less to Seattle, but 600 plus. I think it's important to point out what General McConville was discussing earlier, that those personnel are assigned to those hospitals, and they're going to go into this, for example, the Javits Center. And the whole of government approach is that they're going to put a couple thousand beds in there. But what they're really doing is they're taking pressure off the local and state healthcare system and moving patients into that facility so that we can help those patients, because they're still going to have people with broken legs and car accidents and everything else that will need care for. Therefore, it just takes a lot of pressure off the local and state healthcare system to do that. So the idea here with the Corps of Engineers, with FEMA, and with the state and local officials is to work in collaboration so that we can provide skilled medical professionals to take some pressure off the local and state healthcare system with our Army professionals.
David, do you have any? Go ahead.
My second question is this issue of putting troops up on the Canadian border. It's been reported and confirmed that there are discussions about that, and it's obviously a diplomatic issue. But the diplomacy aside, what would that operation look like? Would that be active duty? Would that be National Guard? How many, etc.?
We don't have any.
No, we don't. Northcom.
Yeah, I think that would be best answered by Northcom. We do not have any directed planning tasks on that yet.
Okay, thank you.
Okay, so we're going to go to Ashley Roque from James. Ashley?
Yes, hi. Thank you. I had a question and then a follow-up. With the notice that went out last night of the stop movement order, what impact is that going to have on soldiers who've already deployed for Defender Europe 2020?
Well, what we're going to see is for the soldiers that have deployed, I mean, it's a 60-day stop movement order. So some of those soldiers that would have been coming back, they are not going to come back. Their tours will be extended. And the soldiers who are getting ready to go, they are staying here and limiting their exposure. And then the commanders in each of the areas, they have exception to policy authority. If they have to have someone to get back or they need someone to get over there, we will work the details on that.
Okay, great, thanks. And then I also wanted to ask on the defense industry base. Last week, you guys had mentioned you were in talks, and some of the states had differing issues and the unions. After a week, is there any other clarity on the situation on possible slowdowns and delays? And have you discussed potential penalties with the companies for not being able to deliver on time?
So you're referencing existing like weapon systems. You're not asking about Defense Production Act authorities in response to the crisis. Just to clarify.
No, no, sir.
So Dr. Jetty and General Murray have done an assessment of the defense industrial base. We have many contractors that are still reporting to work, and they're bending metal and continuing to progress. What we're doing is working with the states, because it really is a state-by-state related issue. If there's a manufacturer in Florida that has a footprint or has parts of their manufacturing division are in like New York or Connecticut and others, you have to work through some of these issues about their employees traveling from state to state. So what we could do is we could make Dr. Jetty and General Murray available and kind of walk you through this very complex issue. But we've been pretty blessed of how these manufacturers are stepping up and continue to put the measures in place so that their employees can continue to work and head down that modernization path.
Thank you very much, and that'd be great.
Okay, we'll do one more. Ashley Tressel. Ashley?
Yes, thank you. Just wondering about, we heard a few of the training exercises have been canceled. What immediate effects to readiness are you seeing, and what do you expect over the next, I guess, few months?
Well, I think what we're going to see is, it's only been a couple of days, so to speak, on some of the training exercises. We'll do an assessment over the next couple of weeks. I mean, ideally, we want to get people back to doing the missions that they need to do. They're still able to train at the low levels, exercising the proper procedures to limit exposure. But we certainly are going to be doing assessments as we move forward over the next couple of weeks.
Okay, so we'll hit Tara.
Thank you. Tara Kopp with McClatchy. Can you tell us how many soldiers total have been tested, and how you're getting test kits out to forward deployed soldiers, say in Afghanistan? How those results are coming back? And then secondly, can you talk about, for the immediate response forces, what does going up to HIPCON Delta mean in practical terms?
I will get that to you. Okay.
So in general, when it comes to the soldiers, we've roughly conducted almost about 5,000 tests. In support of the commanders in the field, downrange, in combat areas, we are leaning forward to give them and deliver that capability in a matter of days to support their missions forward.
How are you getting those tests to them? And like, for example, in Afghanistan, there had been reports that soldiers were not able to get tests, and there were some concerns that there might be a number of cases out there.
So for those that are forward deployed are supported by Lonsdale Regional Medical Center. So those tests are shipped to that location. Normally we have about a 24-hour turnaround time on those tests.
Okay. And then
let me take the one on Delta. I mean, really what the intent is we have forces that are ready to go, just like you saw in January when the 82nd went on. So when we say Delta, what we really mean is we want them to limit exposure. We want them pretty much doing only the essential tasks that they need to conduct. That means they're pretty much home, or they're doing what they need to do at work. They're not out being exposed to other people. They can work out. They can take care of themselves. But again, what we really want them to do is limit their exposure to anyone else and almost create a safety bubble around themselves. And that's what the technique that General Abrams used. You create safety bubbles, and you make sure that all the people inside the bubble do not have the virus, and you keep that separation so you can protect the force. So that's what we're trying to do with them. They're ready to go. And we don't want, one person to expose others and that to reduce our readiness.
Just two more follow-ups. For the Fort Campbell soldiers that are going to the Javits Center, can you tell me how many, and if I missed the specific unit? And then secondly, of the 5,000 tests that you've run, was it because there were symptoms, or was it precautionary for a particular unit? How did you choose those who got tested?
I'm going to let Surgeon General take that.
Do you want Charlie to take the first one? Charlie, you take the first one. Scotty, take the second one.
The hospital at Fort Campbell, it's roughly 350 people. But that, again, in New York, that's 2 hospitals that are going up there, so it's going to be, 650, 700-ish.
And then the tests, again, we're following the CDC guidance, symptoms, and then the medical professionals, again, what he ascertains when he looks at those symptoms and sees that, well, maybe I have to do a test, and that's what occurred.
Okay, so we'll go to Barbara, and then we'll go back on the phone line. Barbara.
General McConville, I wanted to ask you on the operational side. I don't think I understood some of the previous answers. Isn't it the case that Frag 1314 actually says current mitigation efforts have been insufficient? I believe that language is in there, or at least that's what I read in there. And I would like to know what led the Army to the conclusion that current mitigation is insufficient. And along those lines, a really clear explanation. For several days, the Army, other services, but we're talking Army, has said you trust local commanders to take care of when there should be large groups, not having large groups. But you continue to get these reports of large groups, of formations, of PT and significant numbers of people. So with this now increased effort, is there anything that you have mandated not happen? You say you want the kind of bubble that General Abrams had, but he was incredibly strict. There will not be. Is the Army there yet? Or what are you prohibiting, if anything? But why did the Army say that current mitigation is insufficient? What led you to that conclusion?
Well, I think what led us to that conclusion is we're seeing what I would say response to the threat. As you look around the country, we see, the virus, and we see it starting to increase around the country. So what we're trying to do is put the appropriate measures in place to protect the force. And each of these commanders is doing a trade-off. They know they have a wartime mission that they have to train for. They also know they need to protect the force, so they're not going to be ready when they're called. So what we've been doing is watching the threats, so to speak, and as the threat has become more prevalent, we are ramping up the procedures, and we're also checking and getting back briefs from commanders and making sure they understand the guidance as far as how they limit exposure, and we're taking some of that risk off of them. So we're trying to give them guidance on when they, if like we said, we put out some feedback on, hey, we don't think you should, we're going to tell them you shouldn't be having these large type formations. You shouldn't be doing things like town halls and bringing people together. And we have commanders that we have a large organization, and they are implementing those procedures as we speak.
So when you say you looked at American society and you see trend,
yes.
What are you learning within the Army? What in that trend? Do you have trend analysis that tells you it may increase significantly or to some extent in the coming days in the U.S. military?
Well, we think that if we do not limit exposure, and having talked to commanders like General Abrams and General Cloutier, who have been in what some would call very tough spots or hot spots or where it's prevalent, we've really been going to school and, quite frankly, getting advice from them on where we should be in the spectrum, given the threat we're seeing, and we think we applied the appropriate measures for where we're at right now.
Could you just finish your thought, though, where you say, if you do not limit exposure?
Right. I think if what we want to do is protect the force by limiting exposure.
And you think more needs to be done?
Yeah, I think we need to do more to limit exposure, especially for those who are not doing mission essential tasks. So I mean that's what we're really saying right now is when we look at our commands and we say, do you really have to do this task that may increase the risk to our soldiers? Or if you have to do that task, then how can you make it a little safer? You see us standing 6 feet apart, and as we move, we're doing social distance. And when they're doing, they still need to do physical fitness, but don't do it in formation. You still need to train on our aircraft, but make sure the people that are training together, you keep the numbers small, and this is how you limit the exposure.
Can I just have one very quick one?
Sure.
Asking you as a member of the Joint Chiefs and the Army, which often relies on other services for combat assistance out in the field. It's a remarkable day. The aircraft carrier Teddy Roosevelt basically out of commission in Guam because, as you know, they have now had a number of cases. They're pulling into Guam. They're going to test the entire crew aboard the carrier. Long time since an aircraft carrier in this country was out of commission for any type of so-called enemy reason. As a member of the Joint Chiefs, what does that say to the chiefs about the scope of this threat, that it could take a carrier out of commission, a carrier your forces could need?
Well, I think all the chiefs are wrestling with the same issue or same challenges. They want to protect the force, but at the same time, they know they have a mission to protect, and that's the balance. And so, even on, and I defer that to Admiral Gilday as far as what you do on a ship or what we're doing on a post to protect soldiers, but it's almost you want to create bubbles and keep a small amount of people in that bubble, because if one person comes up with the virus, then you don't get into that exponential growth that we see if people are touching a whole bunch of people. So from where we sit, the best thing we can do is keep the exposure or the circle that people run into very, very small. And we kind of like the squad as an example. It's less, it's about 10 people less. You keep your circles very, very small, and that's how you flatten the curve.
Okay, so we're going to go to the phone. I've got a couple more questions. We have Jack from Foreign Policy. Jack, are you on the line?
Hey, I don't have a question at this time.
Okay, we got Mandy from National Defense Magazine.
I do not have a question either. Thank you.
Okay, I'm going to try one more. Sean from Yahoo, and then I'll go back here.
Hi, thank you, gentlemen, for doing this. Both the last time you did this sort of press conference and today, you've highlighted what General Abrams in Korea and General Cloutier in Italy have done. I was wondering if you could talk in a little more detail about what the keys to their success have been, and to what extent those practices are transferable to both A, installations in the United States, and B, civilian communities in the United States.
Well, I think one of the things that I discussed was how do you limit exposure, and what General Abrams did is because he controls the military posts and he controls who comes on and who goes off. You're in a much better position to put in measures that allow people to be tested. They're asked questions when they come on the post. They have a kind of a triage where they can check temperatures, and then if someone does get the virus, they quickly determine who they've seen and what they've done, and they put those people in quarantine. And again, as I've talked to General Abrams, he just reinforces to me is the best you can do to keep the bubble, the safety bubble, and limit exposure, the better off you're going to be. It's much, and he's told me it's much more challenging in the United States because there's things that still have to be done. We have soldiers that have a mission. They got to continue to train. They still have to do combat operations, and so but what you're really doing is mitigating risk, and that's what we're trying to do here.
Okay, so we'll go to Tom.
I just want to stay on General Abrams for a second, because everyone points to him as he's a guy. I think he had one positive case, correct?
He's had a few more. He's had a couple more now.
Secretary Esper said there were lessons learned from General Abrams. So I'm wondering, looking back, why didn't everybody do what General Abrams did? Is it because at that time you maybe thought it was localized in Asia and we didn't think it was a threat in the United States? Is it it was so stringent what he did, it would be hard, if not impossible, to do the same thing in all Army posts, let's say, in the United States. Just walk through what your thinking was back then. And a lot of people say, why didn't everybody do what Abrams did?
Well, I think. Do you want to take that one?
So, Tom, I think what I would say is, again, we were watching it, and we were monitoring it. But I think when it jumped into Europe, really, right? I mean, because that's where it migrated to first. It's sort of, and then reporting out of the Middle East, always challenging, right? So I think the fact that when it was on those two continents, if you will, then really back to General McConville and the Secretary's point earlier, we had a major deployment going on into Europe called Defender 20. That was when we started to think, hey, wait a minute. You know, we've got forces going forward into Europe. Europe's going not in a positive direction. We had ships pulling into port. We had ships pulling out of ports out of here. And I think at that point, the senior leaders in the Army said, hey, we need to change some directions here in the States because we're introducing soldiers into exercises that could, in fact, be infected because it was getting worse in Europe. So the chief and the secretary made a decision to halt, if you will, the Defender 20 so we could sort of stem that tide. And then I think that was really at the point where we became thoughtful about what we needed to do here in the States.
So the bottom line is when Abrams was dealing with it, you thought it was maybe more localized, right? And then it kind of jumped to Europe, and you're like, we have a real problem on our hands. Is that right?
The Chief and I both had the advantage of seeing General Abrams face-to-face in early, mid-February, and then going to the Philippines and Thailand, and you had very small number of cases in those countries, how little those governments knew. When we both got back home, we started putting more time against it to better understand the problem set. And to the point that General Flynn made, once Europe really started lighting up, that's when you saw this was a virus that was just morphing very quickly.
You're saying is at that point you didn't know how bad it was going to get until it went to Europe?
Because there was not enough data to really make a determination at that point.
But why weren't orders given 2 weeks ago to shut down bases and create the bubbles on bases like General Abrams did in the continental U.S.?
With respect, I mean, you're talking about the speed of the decision making, or
the orders from above. I mean, it's been very much at commander's discretion. It's been localized efforts, very inconsistent across the continental U.S. It's hard to understand if, when you became aware in Europe and after South Korea's experience, that you wouldn't have ordered all the commanders to do what General Abrams and General Cloutier had done.
Well, we still have a mission. We still have a combat mission to protect the nation. We still got to keep the force ready, and we cannot shut the Army. Just like first responders, you can't shut down police forces. You can't shut down the Air Force. What we've tried to do is look at what the actual threat is in each of these places, and again, we've kind of slowly brought it up, and we've put the measures in place that I think are warranted where we're at right now.
Okay, so we're going to go on the line for a couple. Is it Helene?
Yeah, hi, thank you. The question is both for the General and for Secretary McCarthy. Do you feel comfortable at this point that the measures you put in place are enough to stem the disease within the Army? And are you, because it does seem, and I think you're hearing the same questions over and over, it feels as if we're still chasing it, and even now it feels as if we're still chasing that. Do you feel comfortable with where you are? And this goes back to why not have done something a little bit bigger a little earlier?
Helene, obviously Chief will comment as well. It's the tenuous balance of continually being ready and being able to perform our current missions to support national objectives, but it's also of stemming the threat. So this is a day-to-day assessment, and we'll take the appropriate measures accordingly. Chief, anything you want to add?
Yeah, I think, again, if we could just shut down every military post and not have a mission, then we could do that. But, it's just like the first responders. It's just like people in hospitals. They're not shutting hospitals down because they continue to do the mission. The Army has the same mission. And we are not shutting down our bases, but what we have done is taking a look at who's mission essential and who's not mission essential, and allowed commanders to apply the appropriate measures to safeguard the force.
But again, Abrams had a combat mission. He was able to do it. I guess that's where we're kind of confused.
Yeah, but see, the only thing I would suggest with General Abrams is different. Okay, his troops are in with their equipment in their bases where they're basically set. He has a lot more control over that than we do. And even now, as he's gone to a higher level because he does not control the contractors the way he needed to. So there's different levels that you have to apply. And he and I have talked about that. It's a different situation in the United States than in Korea.
Yeah, go ahead, Sean. I do want to clarify. I talked to the 8th Army yesterday. A couple times we've said, General Abrams shut down the base. But we hear the Secretary and the Chief keep saying, we still doing PT. I asked the 8th Army yesterday in Korea, I said, did you stop doing physical readiness training? Absolutely not. General Abrams, were your defects open yesterday? Yeah, they're open. Are your gyms open? Yes, they're open. So we say we closed the base. What he said is that we created the bubble. So those are some training things that we have to do. Physical readiness is one of those things that we look at, especially from the Sergeant Major's perspective, that you just got to do. You can't make that up when it's time to be needed. But I just want to clarify that everybody keeps saying we shut it down. Those are things that I asked specifically for Korea and Italy. Did you do this because of your mission? Italy, were you bringing folks in to do individual tasks? Yes. Did you bring folks in right now to do physical readiness? Yes. We create the bubbles so that those that are coming in aren't infected. Like the Chief said, you got a lane. Are you getting your temperature checked? If you're not in that lane, there's a clean route to go to the hospital. So it's not exactly shut the gates and nobody comes into the base. It's mission essential, but there are still things that other places have done to shut things down in the U.S. that they didn't actually do because of their location. It's not a one-size-fits-all, and those are some of the things I think I wanted to highlight.
I think we've shut down gyms in the States. They didn't shut down gyms. So there's some measures here that are actually much more, I would call it drastic, or much more severe than what they're doing in Korea.
Okay, so we're going to do one person on the line. I think we got Laura from Politico.
Hi, thanks for doing this. I'm just wondering if you could tell us a little bit about, there's been some talk of deploying forces in a law enforcement role, and I know some officials have pushed back, said where there's no talk of martial law, but what would this look like if we were to go to that state? What does putting troops out in the public in a law enforcement role look like?
And Laura, this is Dan Hokanson with the Army National Guard. When we look at our soldiers across the 54 states, territories, and districts of Columbia, we are there to really protect our communities, not to police them. And we have no forecast or any planning taking place, and we are not aware of any mission set to go down that way.
But if it came down to enforcing curfews, is that what? I mean, we've seen other countries like the UK use the military to enforce curfews and this kind of thing. So is that something that is under consideration, and what would that look like if it came to that?
Actually, none of that is under consideration at this time. And when we look across the states, they're working very closely with their state leadership about every mission set, and that's currently not any of the mission sets that we're looking at right now. Thank you.
Okay, so we got Carla Babb on the line. Carla, you still on?
I am still on, thanks. Yes. I actually just have a couple of clarifications first, and then I have a couple of questions. But the clarifications are back on the numbers. You guys had mentioned that there were 284 beds that are going to be built in New York. Is that for both the medical units, the 531st and the 9th, or is that for each unit?
No, that's for both. And again, that's what they bring with them. That's not what will necessarily be the final bed count they're supporting.
Okay, understood. And then, so my question is, can you tell us a little bit more about the Army Corps converting empty hotel rooms into hospital beds? Is that still happening? Where are you guys on that process? And Secretary Esper had mentioned that 5 Army hospital units were on prepare to deploy orders, or maybe he just said hospital units, he didn't specify Army. Are they Army units as well, and where and when are those other units going to deploy?
With respect to the Corps of Engineers, it would be important for you to take the opportunity to listen to General Semonite's briefing tomorrow. He'll be able to show you the concepts that they put in place. So it could be anything from falling in on a convention center, a hotel, a dorm room. There's a variety of different options, and all of that really comes down to the proximity to a hospital. So if you're about 30 minutes or less from a hospital, they'll look for existing infrastructure like those that I mentioned, and that's where they will fall in on that, because it's all part of a systems engineering approach for the care, from screening all the way through recovery. And I think what was the second one was?
Second one was on the hospital on.
So
prepare to deploy.
Right. So we have 6 active duty hospitals, as General McConville and the Secretary mentioned. 3 of them are moving to New York and Seattle. So we have 3 more available now. We have a combat mission, and we have forces that potentially could deploy. So we're working through with FEMA and really with Northcom on what they need, and so that's what we have in the inventory, though.
Those are active duty.
And those are the active ones, right? We have a whole. We actually have 15 in the reserve, but that's what we have available.
So just to confirm, the other medical units that have been on prepared to deploy orders are not Army. All 3 Army units that have been prepared to deploy are currently in the process of deploying to New York and Seattle right now. Yes?
Yeah, I'm not aware of other services, hospitals on prepared to deploy orders. You'd have to ask the other services. I know what we have.
So we got Courtney QB on the line. Courtney, you on?
I am, yes, thank you. I just want to be sure, for starters, I want to be sure that it was General McConville who said this, but it was, I think you said that you think that more done to stop transmission, especially among non-essential personnel. Was that you, General McConville?
Could you say that again? I said what I said was we're trying to avoid exposure to other people. So when we look at non-mission essential personnel, the intent is that they stay at home and they do minimum kind of exposure to other people that are outside the bubble. That's how you limit the spread of the virus if someone has that. So the intent is if you're in a HEPCON Delta type situation, you're pretty much at home. If you have to go to the grocery store, you go to the grocery store. If you have to do something emergency type, you do that. Do physical fitness, but we don't need you out on the town, so to speak, being exposed to other people, because we need you for that mission.
Okay, so I mean, I guess the way you said it was that we need to do more. So I'm just wondering if you think there are, with everyone going on force protection, Con Charlie, all that. Are there additional steps that need to be taken? And I know you guys have been asked this over and over, but when you said that, do you think that you went to Charlie and essential personnel and whatnot fast enough?
Well, I think we did. Again, you talk about let's go to Delta. People have been asking us, why did you put the initial contingency forces to that level? Is because we want to make sure we are absolutely limiting exposures. So if we have to react to some situation around the world, they're ready to go.
Okay, thanks.
Okay, so that's it for the reporters on the line. So okay, so we'll just one question so we can get as many out.
Just to follow up again, when we had General Abrams' briefing last week, or maybe it was a week and a half ago, one of the things that really stuck out to me was when they really tightened access, they were actually taking temperature at the gate before anyone could get on. And I think some of us are pushing on why isn't something like that being put in place at these bases, especially in bases like in Washington State and California, where you don't know who's coming onto base and whether, even if they don't have symptoms, they could be a carrier, and it kind of puts that base and those service members at risk.
Yeah, can you talk about that one? Why don't you take that one, because many are doing that right now.
Yeah, I mean, many are doing it, and they're doing it at different locations across the bases. So some are at gates, some are at buildings, some are at entrances. I know units are doing it in morning formation areas to try to gauge and keep everybody, alert and aware of what we're trying to do here by this social distancing.
So I guess on that, because I think.
Yeah, that's what I wanted to say is that just because, if you've been to JBLM, if you look at the access point on I-5, that just normal gate exposure, you're going to clog up the whole road. It just, there should be nobody on the road. So just because you don't check them there and you get to another area doesn't mean they're not being checked. Talked to the Corps Major again yesterday. I had it right up, and that's what he's saying. We're checking at other locations to make sure don't get in big formations. They're still, calling in. They're limiting the people. They're still making the checks, but they're just not doing it. Maybe that because of that access, they've closed some of the gates down too. So it may not make physical sense to do it right there at that gate and that area. That's why it's so important that the commanders do that. Have the flexibility to go, hey, let's check somewhere else. Because it makes sense for that location. And that's what I found for JBLM, plus I was the Corps Major up there.
Well, just to double check, does that mean that everybody getting on the JBLM is having their temperature checked first at this point, or?
Not necessarily. Again, that may not be necessary for what that location is. As like Shane Popsicle said, so I'm going to check the temperature, but do I have to do everybody on every formation every time they move? But let's go to what they're doing for Italy. Italy has what's called an overwatch team to make sure everybody's washing their hands when they go in. So they're checking temperatures, but not necessarily every person, every day, every move.
I guess the question is, why is it so hard to, if you have Army units on bases, to close the entrances and exits, and only essential personnel come on and off, but it seems like there's still a large flow of people coming on to bases, and it's hard for us to visualize how that's safe.
Well, that's why we've gone to Charlie. That's basically saying, normally you have...
We only went to Charlie yesterday, and this started happening several weeks ago now. I mean...
You're talking about the large flow. I mean, how many 70% live off post, right, Charlie? So, much of it is it's a statistics issue. You got the preponderance of people live off post. They got to get to work.
See, that's where it's a little different.
Abrams people live there.
Most of the people live on post. And at least a good amount of them. That's the challenge when you take a look at how our communities.
Yeah, sorry, it took 52 minutes to get there, but that's my fault.
That's
my fault.
No, we
I'll
blew
take that.
But 70%. They're coming off post. What we're trying to do is, and here's where even with you can't. Hey, with my spouse, it's like your dependents have to limit exposure too, and that's what's the challenge is, and that's what we're trying to coach and get out there is because you can do perfect with with the soldiers, but the soldiers are living off post and they have dependents, and dependents are exposing themselves, then you have a real challenge. Not everyone will have a temperature when they're coming on post either. So that's a good. It is an indicator, and that's why we've talked to everyone. As soon as they know they have someone, people are checking. I check myself twice a day.
They don't let us in the office unless we do it.
And,
the conditions are not apples to apples with us and Cloutier and Abrams.
You have said, as of yesterday, current mitigation is insufficient. So what else are you what makes you convinced this will be enough? What else medically and operationally do you think you need to do? And I am puzzled that Defender Europe was some weeks after it began in Korea. You obviously had a lot of contact with General Abrams. Are you satisfied? Are you okay with having not really gone ahead and taken extra measures until Defender Europe? I mean, if it seems that somebody might have told you there was a serious medical problem in the world. But you've said current measures are insufficient. So what else do you guys think What is the best advice you're getting on what else needs to be done?
We're learning every day, Barbara. I think it's
advice with respect, sir, that you're getting now. I mean, no disrespect.
That's okay. You
We're
did it anyway.
looking
That's
for
all right.
practical examples we can report on.
Yeah, I mean, eventually what we want to get to is to know who's been exposed and, get some type of test, because people are going to recover. People are going to be exposed along the way, the vaccination, the treatment, and testing. So we know when we have a case, so we can quickly go into a quarantine type situation. That's the challenge, is to know when someone may be exposed to have the infection, then we can quickly get them the care they need. But if they're coming around and they don't have any symptoms, it makes it much more challenging.
Can we just ask the Surgeon General a medical question?
Sure,
if
please.
we might?
Yeah,
And again, I didn't.
That's okay.
mean
I don't
to
want to practice.
interrupt.
That's who you want to talk to.
Sir, can we try this from a medical standpoint? You're in touch across the military with your medical counterparts in the other services. What are the Surgeon Generals and the medical experts in the military seeing, analyzing? Where is the trend analysis going for the U.S. military? Are you concerned that you are, in fact, you are still on an upward trajectory? Medically, what do you recommend to bring it down? What do you think needs to be done?
So first, I am absolutely concerned that as the trends increase United States Army, that it's going to impact not just our citizens, but our soldiers. Absolutely, that could impact readiness. The bottom line is, and you've heard it up here today, you've heard all the Surgeon General speak it, is we have to limit the exposure. What I call it is the discipline of social and physical distancing. If we can limit and stop the exposure, that can flatten the curve. That will allow the researchers to do what they do best, to find the countermeasures and the vaccines. That's going to take time. And as that time progresses on, we as soldiers and citizens must practice, again, the art and the science and the discipline of social distancing, because this is brand new for us. It's complex. And as we move through these, we got to give the research community the opportunity to find the medical countermeasures, but we must first take the responsibility to protect ourselves, the mission, and support the whole of government response.
What is the medical data showing you, your counterparts? What is the medical data showing you in this country right now? Because I assume you're looking across the board as well to see what's going on in the civilian medical sector. What is the medical data showing you about the upward trajectory? And do you have any analysis for yourselves and the country, but for the military, about when you think you could reach an apex and begin to bring it down? What's the data showing you?
Well, again, consistent, we're hoping that, again, the summer time frame, we are hoping that this is seasonal and that trend will come down. But again, this is new for us. This is complex, it's new territory. And so as we continue, again, to practice the protection of our soldiers, the mission, and our citizens in the country, the art of the social discipline, the discipline of social distancing, rather, is going to be a key factor. Because if we don't, the numbers will continue to increase, and then we are putting ourselves at risk if we expose ourselves. And so again, there's no different trend analysis from what you see. We're anticipating, hoping that trend line will come down as the season changes also.
But you think about another 3 months of restrictions or constraints in the military. You said early summer.
Well, I can only speak to the trend itself. It's increasing. In order for us to stop that trend, we got to limit the exposure. And that's an individual responsibility of every citizen, as well as the soldiers practice that same art.
But what about the need for widespread testing? You said there's been 5,000 tests so far. So you're facing what the American people are facing. There aren't enough tests out there. So you don't know the universe, really, of who's infected until you test, correct?
That is correct.
So how do you get more tests?
Well, once the test kits become more available, then you can increase the testing. I think, and that as the numbers trend higher, we're going to see more testing because now we're getting more positives. And that is automatically going to drive the testing up and that requirement.
I told you about getting more testing equipment and test kits.
Well, right now, we have 9 labs that have the ability to test.
But what about the kits, the actual kits you need to test?
The kits right now, we have a sufficient amount of kits to test our current levels. And
How
as
many?
we
How many?
lean forward to expand our testing, not only downrange, but in our remote areas within the continent of the United States, our ability to test will be expanded, and that will create more demand on test kits and to support material.
But how many kits do you have? How many testing do you have now?
Right now, we have over 9,000 or 19,000 tests available.
Where did you get them from?
Again, we get the same feed from the rest of the country, so they're coming from Health and Human Services, or CDC pushes those kits to us.
And how many do you need?
Well, as, again, unknown, this is new territory. So, again, if we don't practice the discipline of social distancing, the numbers are going to go up. And that's going to drive the requirement for more tests up.
And just want to
So
clarify,
I just-
with the 19,000, when you say test kits, is 19,000, is that 19,000 individual tests? Because sometimes
That
the
is
test
correct.
kit, it's multiple tests.
That is correct.
So it's one test, 19,000
That is
tests
correct.
total you have.
What
Okay.
do you have on here?
That is correct.
All right, sir, so we're at 2, and I know you got a backstop.
We do.
You gotta go to
We got a meeting with our boss here in a little bit, so. Okay?
Thanks a lot.
We'll see you next week.
I thought you were the boss.
What's that?
The other boss.
Not that big guy upstairs, so everybody has a boss.